this community. So welcome to the October Sharp information session on safer sex for older adults living in the community. As most of you know, this used to be called the CHET program, but due to changes in our funding, we've changed from health education presentations to information sessions about resources, services, and tools available to help English-speaking seniors age in the right place. And I know that there can be some overlap sometimes, and certainly staying healthy is an important part of being able to age in place. So this is the context and perspective from which this session will be addressed today. So Crystal Harrison is a youth worker and sex educator who has been facilitating groups and workshops for almost a decade. She's currently the Education for Prevention Coordinator for AIDS Community Care Montreal, which is, the acronym is ACCM. So their Education for Prevention department offers innovative and inspired programs that aim to decrease the transmission of HIV, hepatitis C, and other sexually transmitted and blood-borne infections. So we're really excited to have you here today and to hear more about this topic.
So thank you all for joining me this morning. My name is Crystal Harrison. As was mentioned, I'm the Education for Prevention Coordinator at AIDS Community Care Montreal, ACCM. So ACCM is actually Quebec's only HIV/AIDS organization that serves the English-speaking population in Quebec. So that's truly what sets us apart from other HIV and health community organizations. We've been around for 35 years, and my main role is to decrease the spread of HIV and other STIs through education. So that's why I'm here. I give workshops all over in community organizations and schools. So today we're going to be talking about safer sex for older adults aging in place. So what this means is today we'll talk about why this is an important topic to discuss, to talk about, not only for older adults, but truly for everybody, and kind of why specifically it can affect this population. We're going to do a little HIV 101, where we will learn a little bit more about the virus and how it's transmitted. We'll talk about some other STIs. We'll talk a little bit about prevention methods. And then to wrap up, we're going to finish with some tips and tools on how to talk about sex, how to talk about consent, and some resources on how to get tested and where you can ask questions that you might have about this topic. So that's our plan for today. To start off, why is it important that we're talking about this? So a lot of it comes down to ageist attitudes in society that truly reflect a discomfort in our culture with the idea that seniors are sexually active. These ageist attitudes can absolutely cause older adult sexuality to be ignored, especially by healthcare providers and even in the media. And especially these attitudes are set when we're young. So oftentimes the attitudes we have towards sex and sexual health are set when we're in school, say when we received our sex education, which I don't know about you, but mine was very lacking when I was in school. All I had was my gym teacher putting a condom on his arm all the way up to his elbow and being like, use condoms and get on birth control. And that was the extent of the conversation. So I had to learn a lot of stuff on my own. And yeah, there's a lot of information that is missing, when we talk about classic sex ed. And especially when we talk about HIV, a lot of people might think of the AIDS epidemic in the 80s and the 90s. There was a lot of misconceptions around transmission and around how people were dying of HIV and AIDS. So there's a lot of myths that we kind of still have to dispel in this day and age. So it's really important that we confront and challenge the ideas that we have around sexuality that are given to us when we're young, because they're not always the most complete pictures. So I do have a quote from Madonna, who was I know, a controversial figure. And this was an article that was actually published in our local magazine called Cult Montreal, titled "The Ageist Backlash Against Madonna is Predictable and Tiresome." So I have a quote from Madonna that says, "Once you reach a certain age, you're not allowed to be adventurous. You're not allowed to be sexual. And I think that's rather hideous. A lot of people have said, oh, that's so pathetic. I hope she's not still doing that in 10 years. And she goes, I mean, who cares? What if I am? Is there a rule? Are you just supposed to die when you're 40? So I like this quote because it does kind of encapsulate the ideas that people tend to have. People always comment on Madonna's social media saying, oh, she should act her age, when what does that mean, acting your age? Like, especially when we're talking about sexuality and things like that. There's no way to act your age, just be yourself. And a study that came out of Alberta in 2020 actually showed that a growing proportion of HIV diagnoses were coming from people over 50 years old. And back in 1990, those cases were about 7% of new HIV cases were in people over 50. Since 2019, that figure has risen to over 18%. So there is an increase in HIV in people over 50. It was happening most often through condomless intercourse, either through men and women, between men and men. So 29% men and women, between men, 27%. And then there's also some factors that can help or that can affect older people taking their HIV medication. They tend to have more challenges managing that medication, say if it's contradicting with other medications they're already on. But taking medication when you have HIV is very, very important to having a long and healthy life. We will talk more about that shortly. In Canada currently, there's about 62,790 people who have HIV. And since the onset of the COVID-19 pandemic, there has been a huge decrease in access to testing, which I know when all the hospitals and clinics had to shut down, it was only emergencies. We could not access our doctors, things like that. That has kind of continued into 2023. So people are still having maybe a hard time accessing testing clinics, which is a huge part of why we're seeing a rise in cases of sexually transmitted infections all across Canada. And this is in every age group. So we're seeing increased gonorrhea, chlamydia, syphilis, as I mentioned, an increase in HIV. So a huge reason this is happening is because of decreased access to testing. So it's very, very important to be getting tested. And when we talk about misconceptions and stigma, stigma is kind of those preconceived thoughts that we have about people who might have HIV and STIs. These still persist to this day. And it's really important to acknowledge that HIV and STIs can affect all people, regardless of age, gender, sexual orientation, etc. It's something that affects absolutely everybody. So we're here to get rid of that stigma and talk about sex. So let's get into our HIV 101. So this is going to be a very brief overview about kind of an introduction to the virus. So when we say HIV, that stands for Human Immunodeficiency Virus. Human meaning it can only affect humans. So you may have heard of the feline immunodeficiency virus, which can affect cats. HIV is not species transmittable, so it can only ever affect humans. Immunodeficiency means it affects our immune system and makes it deficient. Virus means it's a virus like any other virus. So another virus could be chickenpox is a virus, say flus, things like that. So someone who has HIV is HIV positive, or sometimes we refer to them as seropositive. And it's very important to note that there's not actually any symptoms necessarily to having HIV. So somebody could have HIV and have no idea that they have it, mainly because all it does is affect your immune system. So if you have HIV, you're far more susceptible to, say, what we call a secondary or opportunistic infection. So if you have HIV, say somebody around you has a common cold and they have a little cough, they're fine in a couple of days. If you were to get that same cold, maybe it would stick with you for months and you would be sick. Maybe it could develop into pneumonia. So there is the possibility that kind of common illnesses can affect you much harder if you have HIV. And that's a little bit of the irony there, because in the height of the AIDS epidemic, everybody was terrified of people who had HIV, right? They didn't want to shake hands with them. They didn't want to be in the same room as them. There was a lot of misconceptions about how you could get it. And people were really scared of people who had HIV. But as I mentioned, it should kind of be the other way around, because if your immune system is compromised, it's other people who are putting you at risk, right? And this is something we definitely saw reflected during the COVID pandemic as well, of if you're immunocompromised, you're at a much higher risk of catching COVID. So it was those people had to be protected from everyone else. So HIV works very similarly. AIDS is acquired immunodeficiency syndrome. So when we talk about AIDS, a lot of people think it's autoimmunodeficiency syndrome, but it's actually acquired. And acquired is really, really important because it means you can't randomly catch AIDS. It means it's the syndrome that can develop from HIV. So again, HIV is the virus that can attack your system, and AIDS would be the illness that will result if it's left untreated. So the HIV being left untreated is the really, really key part here, because nowadays, most people who get HIV start taking their medication. And so most people are not actually developing AIDS. So at our organization, even though AIDS is in our name, AIDS Community Care Montreal, we are actually working most often with people who are living with HIV. So if somebody is not on their HIV treatment, it can take 7 to 11 years for it to develop into AIDS, but often it never will. So it can stay HIV for your whole life. And again, you cannot catch AIDS. So this is something I hear very often say if I'm working in schools, being like, oh, I caught AIDS. Like people talk about it like you're catching cooties, kind of things like that. But you can't catch AIDS. HIV could develop into it, but most often it actually does not, now that we have adequate medication. So that's the difference between HIV and AIDS. Now we're going to get into transmission, which is my favorite part, the part that I said I get very excited about, because this is where there's a lot of misinformation. And when we talk about HIV, it's not often in the common, there's a few movies that Hollywood likes to make about HIV and things like that, but people aren't generally talking about it. It's not in the news that much anymore. So there's not a lot of information available publicly about how you can get HIV or the reality of living with it. So you really have to kind of seek out that information. So that's why I'm so glad everyone is here today getting this info. And when we talk about transmission, you can really break it down into a simple way, meaning there's 2 things that are needed to pass on HIV. The first thing is 5 body fluids. So there's only 5 fluids in the body that can pass on HIV. And these are very specific fluids. So these are fluids that are only present when you're engaging in certain activities. They're not the fluids that we come into contact most commonly in our day-to-day life. So these fluids are blood, semen and precum, vaginal fluid, human milk, so that would be like breast milk from the chest, and rectal fluids. So these are the only 5 fluids that can transmit HIV. Again, you're not coming into contact with these fluids all the time, like walking down the street, you know? These are specific situations: the blood, semen, vaginal fluid, rectal fluid, and breast milk. And it's also important to note that the breast milk can only transmit HIV to a baby during feeding. So if a healthy adult were to ingest breast milk that had HIV in it, they would not get it. It's only because the baby has that weak immune system. It's also important to note that there needs to be a high amount of the virus in these fluids. And so people who are taking their HIV treatment will have a low amount of the virus and they can't pass it on. So that's just an extra tidbit. So you need those 5 fluids. 5 very specific fluids, as I mentioned. And then those 5 fluids need a way into somebody else's body. So they need an entry point, right? Those entry points can be broken into 3 categories. So the way that those 5 fluids would need to come into contact with either a fragile membrane. When we say a fragile membrane, that would be the vagina, the anus, the penis, or direct contact into the bloodstream. And that would be a high-risk situation. So that would be, for example, those fluids are coming into contact with a high-risk situation. So that would be, unprotected vaginal sex or anal sex. If it's a low-risk situation, it's coming in contact with the mouth, the nose, the eyes, or you're using a barrier. And when we say barrier, that's a condom, usually. So you can add a condom to sexual intercourse and it becomes a low risk situation. The only risk in that situation is, say, the condom slips off or it breaks in the middle of it. And then there's situations where there's no real risk of transmission, which is when it's healthy skin. So our skin is a really, really good barrier against HIV and other infections. So even if you have a little scratch or a scab and say you get somebody else's blood or those fluids on it, there's no real risk of getting HIV that way. So just to reiterate, the main ways that we can get HIV would be through sex. So that would be vaginal sex, anal sex, not using condoms and barriers. By sharing needles as well. So say you're sharing prescription drug needles or injecting substances. It could be steroids, it could be hormones, it could be drugs. Sharing needles because you get that direct contact to the blood. It can be passed as well to a baby during pregnancy, or as I mentioned, during breastfeeding. If you're sharing needles, getting tattoos or getting piercings, things like that, those can also spread HIV. So it cannot be passed by shaking hands or sharing food with somebody who has HIV. So it's not transmitted through saliva. And this is really interesting. This is something I think a lot of people don't know. A study was done in 2019, a survey across Canada, and half of the people in Canada said they would not share food with somebody who has HIV. So half the people were understanding that you can get HIV. Other STIs have different transmission methods. When we get to them, I can talk about them a little bit. Most of them, though, are, as we talk about sexually transmitted infections, most of it is the same way in the sense that it's the sexual fluids that are transmitting them. So again, that would be semen, that would be vaginal fluids, that would be rectal fluids, can transmit sexually transmitted infections. Some of them can also be transmitted through saliva. So HIV cannot be transmitted through saliva. Some STIs can. And again, it's not in sweat or urine or feces or vomit, things like that. You can't get it from a swimming pool or a water fountain. It's very specific situations. And you can't get it from insects or animals, as I mentioned. So mosquitoes, for example, cannot transmit HIV. Mosquitoes can transmit other viruses and diseases, but they do not transmit HIV. So that's HIV transmission. I know it's kind of a lot of information, but I think it's just important to know. And as I said, if you break it down and you think, okay, it's only those 5 fluids that can transmit HIV, it makes it a lot simpler. And you realize there's really these specific instances where you can get HIV. So U equals U is a really amazing advancement in the world of HIV. It's something I also get really excited about. So U equals U stands for undetectable equals untransmittable. So I've included a little picture of me walking at Pride with one of our posters. Advocates for Science, Not Stigma is what our t-shirts say. So this was ACCM at Pride. It's a huge point of advocacy for HIV and AIDS groups. What it means is undetectable equals untransmittable. People living with HIV who are on their treatment cannot pass on HIV. So there's not enough of the virus present in those fluids to pass it on. So it sounds very simple, but it's very important. There's a ton of scientific evidence and studies that have been done about this, and it builds on treatment as prevention. So this means you can have HIV, you can have HIV for your whole life, and if you're taking your treatment, you will never give it to anybody, no matter what activities that you're doing. So you could be engaging in sex, you could be sharing needles, you can be doing all of those risky behaviors, and you won't transmit HIV because there's not enough of it in your body. So this is huge. This allows people to have very healthy romantic and sexual relationships. This allows people to have families. And is a huge part of people living kind of long, happy, healthy lives, which was not the case 30 years ago when you got an HIV diagnosis, correct? So this is huge. Again, I get very excited. U equals U. It's really amazing. It just shows how far the medication and the science has come, and it really affects how people who have HIV can think about themselves. So the media often, as we said, would show people being scared of people living with HIV as these vectors of disease, or it's scary to have HIV. And this just proves it's not. You actually can't, even if you have it, you can't transmit it if you're taking your medication. So it's really important, really exciting. It has been adopted by the government of Canada in 2018 as part of our, Public Health Canada acknowledges that U equals U is a thing and that they accept it. The studies have been done. The government of Canada backs it, which is really cool. So that's U equals U. When we talk about the prevention and treatment of HIV, as I mentioned, prevention is condoms. So using a barrier method when engaging in sexual activity is a really good way to prevent the transmission of HIV. Using new needles every time. So if you're using drugs or, again, hormones, piercings, tattoos, things like that, very important to just use a fresh new needle every time. And this is also something very interesting that not many people have heard of, is that there's actually a medication that can prevent HIV. So it's called PrEP or PEP. So preventative or pre-exposure prophylaxis or post-exposure. So that's a pill you can take before you encounter somebody who may be HIV positive, or post, which is one you can take after. So say you've had an encounter with somebody and you're like, shoot, I didn't use a condom. I don't know their HIV status. Like maybe I got exposed to HIV. You can take this medication up to 72 hours after that exposure, and it will prevent you from getting HIV. So not many people know these medications exist. It's very, very cool. One easy way to think about it is almost like birth control or emergency contraceptive or Plan B after a sexual encounter. So you could take a pill every day to prevent getting HIV, or you can take one after a potential encounter. So again, something I'm very excited about, this new medication that comes around that, yeah, can prevent the transmission of HIV. And treatment is a huge part of prevention, as I mentioned. There is no cure for HIV, but the medication exists that enables people to live normal, healthy, active lives. And if you're taking your proper treatment, you won't be transmitting HIV. So taking the if you're HIV positive, taking your medication is a huge part of preventing the transmission elsewhere in the community. So that's our HIV segment. We're going to move on now briefly to sexually transmitted infections. So I'm only going to cover some of the main ones. There's a lot of info around STIs, so I'm not going to go too deeply into the specifics of each of them because, again, it's a lot of information. It gets kind of scientific and really specific. So we're going to talk kind of generally and really take away the key points here. So when we talk about sexually transmitted infections, they can fall into three categories: bacterial, parasitic, and viral. Bacterial sexually transmitted infections would be gonorrhea, chlamydia, and syphilis. And so these act very similarly to if you get a bacterial infection, say in a cut or a wound, a bit of bacteria has gotten in there, you have a bacterial infection. Same thing with an ear infection or a sinus infection, say that's often caused by bacteria. Those operate very similarly. Parasites are kind of icky, that they're literally little tiny parasites, little bugs that exist on our skins. So crabs or pubic lice are ones that occur in pubic hair. And scabies is also a parasitic STI, which is tiny little mites that exist on the skin. So both of those often present with itching or little marks, red little bites, things like that. Viral STIs are, again, just like other viruses that operate in our body, like the flu or chickenpox, the most common ones are HIV, hepatitis B, HPV, and herpes. So those are the three main categories. Again, I'm not going to delve too deep into specifics of any of them because each one of these may present with different symptoms. There's, as I mentioned, there's the three different kinds. They all operate very differently in our body. So we could talk about STI symptoms and how they present in the body, but it's actually not super helpful because the most common symptom of STIs is no symptoms at all. That's also a trick question. So it's not super helpful to discuss STIs in terms of symptoms because a lot of them don't present with them, which means you could have an STI and not even know it. You would have no idea you have it because you're not presenting with any symptoms. And even if you don't have symptoms, you could still pass it on to other people. So it's really important to be thinking of it that way, being like, even if I don't think I have it, you could, and you could still pass it on.
You know, if I can't feel the disease, right? Why should it matter? Why should I care? Like, are there long-term effects of untreated STIs that?
Yes, that's a great question. So yeah, if you're not having any symptoms, why does it matter if I have a sexually transmitted infection? So even if you're not having the, say, external symptoms, it can still be kind of wreaking havoc on your body, which is not good. So untreated STIs can lead to a lot of more serious complications. If we talk about chlamydia and gonorrhea, for example, so those are, as I mentioned, bacterial infections. Those can lead to other infections in the body. It could become a urethra infection, in the bladder, in the kidney, and both of those can actually lead to infertility in both men and women. So chlamydia and gonorrhea can go up to affect the fallopian tubes and the testicles, leading to infertility. When we talk about HPV, human papillomavirus, this one is quite commonly known as well, actually. If left untreated, HPV leads to several forms of cancer. So it's part of the reason people with uteruses have to get Pap tests. We're testing for that HPV to prevent cervical cancer. It can also cause throat cancer in others as well. So HPV can lead to cancers. And syphilis is a really nasty one. If most people will have symptoms from syphilis specifically. Syphilis presents often with sores around the mouth, the anus, the vulva, the vagina, the penis. So a lot of sores will initiate. And then a lot of flu-like symptoms. So headaches, fatigue, body aches, pain all over. And if it is left still untreated, it can actually lead to full nerve damage. And some people have had to be amputated from syphilis, and it can start to cause organ failure eventually. So syphilis is a really bad one to be left untreated. I mean, all of them are. And as I mentioned, HIV left untreated could develop into AIDS, which is when it becomes more fatal, truly. If you develop AIDS, that's when you have a second infection. And yeah, your immune system is really shot already. So when we talk about treatment of STIs, the bacterial ones can be cured with antibiotics. As I mentioned, it's similar to another bacterial infection like your ears or your nose. You take your course of antibiotics, boom, it's gone, you're all good. So those are quite easy to cure if you're taking the antibiotics. Parasitic ones can be cured with medicated shampoo or topical drugs. So that would be, say, a lotion, using the shampoo. It kills the little bugs that are on your skin. And again, you're all good. They're taken care of. The viral STIs have a little bit of different treatments. Again, HIV has no cure, but you can take the medication. The same goes for herpes. So herpes is one of the most common STIs and can present as either cold sores or genital warts on, or warts on the or lesions on the genitals. There's no cure for herpes. So again, that would be a virus that exists in the body for life, but there's also medications that can reduce outbreaks. There is a preventative vaccine for HPV and hepatitis B. So you can take the vaccines and hopefully that's part of treatment, is preventing getting it. Most often HPV is cleared on its own, and same with hepatitis B. So that's a very quick breakdown of STIs. I know it's fast and it's a lot of info, but the really important thing to take away is that most of them don't present with symptoms. So if you're not getting symptoms for STIs, the only way you know that you have it is to be getting tested, right? And it also ties into our conversations around stigma of there's no way to know if somebody has an STI. There's no way to know if somebody has HIV. They don't present with symptoms. They don't affect anybody in particular. So again, these can be transmitted through sexual contact. Most often, sometimes they can be spread through bedding or sharing bathing suits, sharing clothing, things like that, especially for the parasitic STIs. Some can be transmitted through saliva. So it really depends on which STI we're talking about. And yeah, the most important thing is that we're getting tested though. And as I mentioned, there's been a huge decrease in testing since the onset of COVID-19. Here is a little graph that shows syphilis rates in Canada. This was specifically for males. The graphs did have a breakdown of every single category of, men and women, every age group. So this shows that since 2010, there's been a huge uptick, especially in the age range of 25 to 29. It was, I believe, 109% increase in rates of syphilis. So that is going up. And as I mentioned, the graphs look the same for gonorrhea, for chlamydia, HIV as well. So all of these STIs are on a huge rise across Canada, across every age group as well. So you can see this is split into age groups. 40 to 59 has an increase, 20 to 24, 25 to 29, 60 plus has an increase. All of the age groups are going up. So that is a little concerning that, STIs are on the rise everywhere, especially when we have, an increased access to information. We would hope it would be the opposite. So this is why getting tested is super, super important. And using other prevention methods. So other prevention methods would be condoms, as I mentioned. And negotiating condoms can be really difficult. We know that's a tricky conversation to have. It can be really awkward. And sometimes people expect one person to bring it rather than other people. But it's like, when I was in high schools, oftentimes it's like, oh, well, the boy's supposed to have the condoms. I don't need to have condoms. The guy should have it. When in reality, everybody should be carrying it. We should all be, taking care of our own sexual health. That's why we call it a shared responsibility. So yeah, talking about condoms is a huge part, but we also know, hey, maybe you don't want to use condoms. Maybe you've been tested recently, which is great. So getting tested is a huge, huge part of, again, prevention. It's recommended that you get tested every 3 to 12 months. So a lot of people don't know that frequency. 3 months, depending on your level of sexual activity. If you have several partners, if your partners have partners, if they're using protection, if you're not using condoms, things like that can all affect how often you should get tested. So every 3 to 12 months is what's recommended. And lube. Lube is a huge part of STI prevention. People often think of lube as just for pleasure, which it absolutely is. It's a huge part of pleasure and increasing sensation and slipperiness. But a lot of bodies don't necessarily create their own lubrification. When we're talking about vaginal sex, some vaginas do create lubrication that can decrease as we get older, or there can be certain medications or illnesses that can prevent that natural lubrification. So adding lube can prevent those tiny little rips or tears happening in the vaginal canal, which can increase the risk of STI transmission. So lube is our best friend. We love lube, especially when we're talking about anal sex as well. So the anus does not create any lubrification naturally. So that's why it's really, really important to be using lots of lube when we're talking about anal sex. So yeah, lube is our best friend. We love lube. At ACCM, whenever we hand out our condoms, we also give a little packet of lube with it because they go hand in hand in our minds. So as we mentioned, this can be kind of a spicy topic. It can be awkward. It can be very uncomfortable for some people to talk about sex. And that doesn't mean we shouldn't be having these conversations. So I just have a couple of kind of tips, things you can keep in mind that can make it a little bit easier to discuss these things and can make other people feel more comfortable talking about sex. So one thing to keep in mind is that sex can be great, but it's not necessarily for everybody. So I'm not trying to push anybody into having sex if they're not interested in it. This information is helpful, again, for those who are not maybe engaging in sex right now. Maybe you have friends or loved ones or anybody who's engaging in it. And the non-judgmental aspect. So you be open to whatever someone is into, even if it's not what you're into. We often call this, don't yuck my yum. That's how we refer to it. So everybody's into different things. All that matters is that it's consensual, right? And everybody who's doing it is into it at the same time. So yeah, don't yuck someone's yum. As long as they're into it and it's consensual, that's all that matters. In the same vein, there really is no normal. So I always get these questions. What is it normal that I like this? Is it normal that my body does this? It's really, really easy to say, oh yeah, that's totally normal, because we want to reassure people, right? We want them to feel better. We want them to feel more comfortable. But this can actually create more stigma and can reinforce the idea that some things are normal and other things are not normal. So instead, it's better to reply to those questions with, oh, it's really common, or a lot of bodies do that. Many people may feel the same way that you do. Many people are into the same things you're into, even if it's not something you're personally into. So that's one tip to kind of make everybody feel better about talking about it. When we talk about consent, so consent needs to be ongoing, continuous. Consent is everybody being in agreement, right? Saying, yes, I want to do this activity. Yes, I like this. Consent has to be established for every act. So if they've consented to doing one thing, it doesn't mean they've consented to all the other activities. And nothing makes it automatic. So being in a relationship with somebody, for example, does not mean that you have consent to partake in any activities with them necessarily. You still need to ask them. You still need to establish consent. And the thing with getting consent is it doesn't have to kill the mood. It doesn't have to be this big, you're not pulling out a consent form saying, will you sign the dotted line to engage in sexual behavior with me? That's not how it actually plays out in real life. There's things you can ask to establish consent that can make you check in during the act and still keep it, fun and spicy. So you can ask questions like, is this good? Are you still liking this? You seem quiet. Are you okay? Are you comfortable? Do you want me to keep going? Can you show me what you like? These are all types of questions that establish consent and are part of the check-in process, allowing the other person to say, yes, keep going, I like this, or you know what, maybe let's take 5. Yeah, so just important ways to incorporate consent into all of your sexual activities. And we want people to feel good, right? And feel they have choices. So that's part of that kind of check-in process of not making anybody feel forced or pressured into anything. Especially when we're talking about sexual activity, there's no one way to go about any type of sex. Everything is valid. There's a million ways to do every type of sexual activity. So just making sure they know what those options are. And again, if you're comfortable talking about sex, it will make others more comfortable too. So, as I said, how we're taught sex when we're young can really stay with us for a long time. We can kind of ingrain that awkwardness, that taboo, that the fact that it's a sensitive subject. So we really have to challenge that. And if you show up to a room or conversation, say, "Hey, I want to talk about sex. Do you have condoms? When's the last time you got tested?" That other person will often feel a lot more comfortable if you're, showing that you're comfortable talking about things. And we don't want to make anybody feel scared or guilty about what they do. This really used to be a common approach to sex ed, that kind of shame aspect, but that really promotes unhealthy attitudes. So we want to be open. We want to be, sex is a completely natural part of life, and people do it for their whole lives. And we want people to feel good. As I mentioned, when we incorporate pleasure and feeling good, people are more likely to take care of themselves, more likely to make decisions that, make them continue to feel good. So we don't want to focus too much on the potential risks. We want them to know, hey, these are the potential risks that could happen. As I mentioned, you could get HIV, you could get STIs from having sex. Those are not the only outcomes from sex, though, right? There's a lot of pleasure and intimacy and all kinds of other things that can happen. So our role at ACCM and as sexual health organizations is truly just, hey, here's all the potential outcomes, and here's how you can make it a little bit safer for yourself, make it feel best, because when we feel safe is often when we feel best. As I mentioned, there is still some stigma that exists around people living with HIV and STIs. So this is an old poster I found saying, "She may look clean, but pickups, good times girls, and sex workers spread syphilis and gonorrhea." So kind of an old stigmatizing poster that was around probably in bathrooms and things like that. So if we want to challenge the stigma and change the way people think about sex and STIs, we need to talk openly about it. Again, I'm so happy everyone is here participating in this conversation, this workshop. That is really step one, is just have the conversation. If we're not talking about STDBIs, so sexually transmitted and bloodborne infections, they can seem less common than they actually are. So as I said, they're hugely on the rise right now. We need to be talking about that. Not that many people are discussing that, and it's kind of can lead to more cases. So if you say, hey, they're on the rise right now, let's take protection. When we talked about U equals U, undetectable equals untransmittable, you can, spread that news, spread that gospel. As I said, it's a huge part of advocacy for us at ACCM, and not that many people know about it. So you can talk about it openly with other people. And if ever you hear somebody who says something offensive or inaccurate, maybe give them a gentle correction and say, "Oh, actually, you can't catch AIDS," or "HIV doesn't only affect people who are homosexual men. Anybody can catch HIV." Things like that. So if you hear something, it's important to kind of pipe up, give a little correction. And it's important that we are mindful of our own language. So it used to be really, really common that, say you went and got tested for STIs, you would say, "Oh, I'm all clean." If you say clean, that kind of implies that somebody who does have an STI is dirty. So it's best to say, if you get your test, you say, "Oh, I'm negative. My results are negative. I don't have any STIs." It seems like a very simple switch, but it can make a really big difference. It doesn't imply that other people are dirty, and it's less stigmatizing behavior. So it's really important to kind of change our own language when we're talking about it and show that we're allies for other people.
Since there's a lot of stigma associated with STIs, how would you recommend starting the conversation with a potential sexual partner?
Oh, that's a great question. It can be very scary, especially if you're the partner with an STI. You don't know how someone's going to react. And as we said, it's very common, right? If we're talking, as I mentioned, I can use the herpes virus again, 50 to 80% of people have that virus. So there's a good chance that, say, your partner may have that virus within them, and they might not even know, as we said, right? Maybe they're not having symptoms. They don't know they have an STI. So a lot of it comes back to that tip of how you present the subject will make other people feel at ease. And so you can say, whether or not you yourself have an STI, you can say, "Oh, I've recently gotten tested, by the way. My results were negative. I would love to know kind of when's the last time you got tested? What's your status?" And preface it by saying, and let them know, if you have an STI, I'm open to taking these steps to make it more safe for us to engage in sex. Acknowledging that, an STI is not a moral failure, right? Someone hasn't done anything wrong to get that STI. It's just something that happens. And if you're the one with an STI, just being open about it and saying, hey, like, by the way, I have an STI currently. Either I'm on treatment, or this is what I do to mitigate the risks. I have had, happy, healthy sexual relations in the past. My partners have not gotten the STI. Here's how I prevent transmission. So just being really upfront, being comfortable, and being open to the conversation is, I think, a really, really big part of it. And coming in kind of knowing the steps that you can take to prevent transmission can help other people feel at ease. If you're the one with the STI presenting the conversation, saying, these are the steps that I take to prevent transmission. Are you comfortable with this? This is what has worked for me in the past, things like that. And before we wrap up, I'm just going to go over two really, really great resources that you can use. This is an amazing website that is created by Portail VIH, which is the HIV portal website. So this is an interactive map for all of Quebec. So as I've mentioned, getting tested for STIs is very, very, very important. And people have been doing it less often now. So I want to encourage everybody to go get tested. So what you can do is zoom in on your location. So I'm going to zoom in on Montreal because that's where I am right now. Again, this is for all of the Quebec area though. So here's the island of Montreal. And in blue are all of the places that you can get tested for public clinics where you can get tested for STIs. In red is community organizations. So our organization is right here in the village of Montreal. And in green is any private clinics for STIs. So you can click on a clinic and it will tell you, yes, we have a youth clinic. We do HIV and STI testing. If you want to call, here's the extension number from Tuesdays to Thursdays. Perfect. There's all the information I needed to know about how I can go get tested. So you can click on whichever clinic is closest to you. You can open it up in Google Maps after. It will have the clinic location and their phone number, how to book a clinic. So this is a really, really great tool. As I mentioned, it does all of Quebec. So wherever you are, you can log in and say, where's the closest place I can go get tested for STIs? So I recommend everybody do that. The other resource I want to show you about is called Sex Ed. So this is a very cool program that we run at ACCM, which is a sexual health texting line. So it's free and confidential. Anybody can send a text to this number, 514-700-4411, with any question they have about sex, dating, or relationships. So you can text us and say, hey, this is my postal code. Where's the closest place I can get tested for STIs? Or you can text and say, hey, my partner doesn't want to use condoms. How can I talk to him about this? I'm not feeling comfortable with that. Or, yeah, I think I might have an STI. What can I do? Or my partner has an STI and I don't want to catch it. How can I be safer? Any type of question you have, you can text this number. And any questions you have in general about sexual health, if there's something you've always wondered, but were maybe too shy to ask or didn't know who to ask, this is the number for you. So you text this number, and we're a team of trained sex educators who runs this number. So it's a personal response. It's not just a robot. And we will respond within 24 hours. So we do need a little bit of time to research. So it's not an immediate response, but always within 24 hours, we will text you back. And we don't get your name, we don't get your phone number, we get no information about you. We just get your question, and then we respond and give you your answer. So it's a great number to keep in mind, and save it in your phone or write it down. If ever you have questions about sexual health, you can reach out to us and it'll be our pleasure to respond to you within 24 hours.
Yes. Is it available in both English and in French? And are there any posters or promo tools that we can print out and share with our community members?
Yes, so our service is offered only in English, but there is a French equivalent. And when you text it first, you actually get offered to say, oh, here's the French equivalent if you're looking for it. The French equivalent is online. Ours is through texting on phones. The French one is a website that you submit your questions to. And we have tons of promo material. If anybody wants it, I can send a little package to you actually in the mail with some posters and business cards and things like that. Be happy to send it. We usually put it like up in bathrooms and things like that in schools and community organizations. We have tons of business cards we can hand out. So yeah, I would be happy to, if anybody wants to send me a mailing address, things like that, I'd be happy to send a promo package to anybody.
I would suggest that just organizations, but just organizations ask for this. Individual, I don't think it's appropriate for individuals to be sent all of these resources.
Yeah, I don't need anything personal.
Yeah.
Yeah, any additional questions, any extra resources anybody is looking for, that's literally my job. So feel free to reach out. I'm happy to help in any way I can. And that is it.
Yeah, so that's perfect. Thank you so much, Crystal, for this really informative presentation and for all the resources that you provided at the end that I think are really invaluable.
Perfect. Thank you everybody for coming today. I really appreciate it. As I mentioned, I get excited and have so much fun talking about this. So I'm so glad we're here today. Thank you.
That's great. Thank you so much.